So the tips to really help them, I think, for those who are not infected and are still healthy, really comes back to the things I've been teaching in organizations. Have a routine. Even if you're not working, it's very important that we have a goal each day, and we have a goal not only for ourselves, but we have a goal to connect with someone else. And at the end of the day, we should really celebrate that goal. And around that, trying to build a routine. And this goes for people who have been put on furlough or job retention schemes where they're perhaps not working. They still need to keep that routine of getting up, having breaks, having regular meals, setting goals, noticing their achievements. Really fundamental. The second thing, being aware of what we can control and what we can't, and really setting up our systems for how we manage that. So maybe making a list of people we could call when we're worried, maybe having a new hobby that when we're worried and we're getting overwhelmed with our thoughts, we can distract ourselves with learning an instrument or reading or cooking. And then that third piece again, this self-compassion. Can't reiterate it enough. There's a lot of research by Kristen Neff on the impact and the importance of having compassion, because we're often very compassionate of other people. I feel so sorry for you. I understand this is hard, but when it comes to ourselves, we don't offer that. And it's really important at the time that we give ourselves that.
Knew what I was or who I was.
What we need to be aware of is that often after any kind of physical trauma, health trauma, there can be a residual anxiety, and that's really something we have to be aware of. For some people, they will come out, they will be so grateful to be alive, that they will have a released sense of life. There's something we call post-traumatic growth, where after a trauma, people become very aware of what matters to them, and they can grow stronger as a result of this. And we see a lot with people who have had major accidents. We see that post-traumatic growth syndrome. What we might see, though, is that people find it difficult to kind of trust life again. They might feel always that they might get sick. There might be that residual anxiety. So being compassionate to that as we move out, that, people might hold on to that. And if we're listening, if we're trying to support people who are going through that and who are really questioning their mortality, it's really about not telling them to feel different, not telling them to not worry, but just listening to them and accepting that that's how they feel. Because it's very easy for us to say, oh yeah, but you're healthy again and it's okay. But for them, they just need that support to be listened to and accepted to help them through that process.